Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex, to self-love, to questions about body parts. Let's get this episode started. Alright, so I have 5 questions on the vagina. The first one is how to wash the vagina. So, when it comes to maintaining your vaginal health, it's important that you don't actually clean in the vagina because there are a lot of great things happening in there that keep your vagina healthy. It's an acidic environment, meaning that it keeps the pH at a little bit of a lower level, and that helps kill any bad bacteria that get in there. So don't wash in the vagina, and that means also no feminine products. Don't do any of those suppositories or deodorants because they can also mess with the normal makeup of your vagina. So don't wash in the vagina, but what you can do is use a gentle soap and wash around, so wash what we call the vulva, or the area around the vagina. The clitoris, the labial lips, the anus, all of those areas you can wash with a gentle soap and then wipe off when you're done. Second question, is it normal to have white or clear stuff coming out of my vagina? Absolutely. Totally normal. We don't talk about it a whole lot, but almost every single person with a vagina has vaginal discharge. And what that means is that, again, to keep that inside of the vagina healthy, there are some good bacteria that live in there that naturally produce a little waste, and so that is flushed out of the vagina. There's also some dead skin cells, as well as some mucus that comes from up inside of the uterus and the cervix that help flush out that vagina. So having a discharge, it's usually clear or white, maybe a little bit yellow. Sometimes it looks like snot. It can happen most days that you're not on your period. If you need to wear a pad to kind of protect your underwear or catch it, that's totally fine, but most of the time it's just a little bit that's left on your underwear. And again, this is absolutely normal. The abnormal things would be if your vagina itches, or if it burns when you pee, or if it's red or tender. That might mean the discharge is a sign of something bad, and you might want to go to the doctor to have that checked out. But otherwise, it's absolutely normal. It's called physiologic leukorrhea. Perfectly normal, absolutely fine. But that brings me to the third question, as is the discharge supposed to get hard on your underwear? Yes. So as it dries, it can crust up and leave kind of a firm feeling or a firm layer on the inside of your underwear. That should come off in the wash, not a problem. Fourth question, how is the vagina supposed to look? Let's take a look. I'm bringing you in. This is a very rough drawing of the outside of the vulva, or the area around the vagina. So this is just underneath. So if you pull back the outer lips, you will see inner lips. So these are called labia, and these are outer labia, right here. And these are inner labia. The inner labia can look like a variety of things, which I'll talk about later. But where the two labia meet up, the inner labia, is the clitoris, or the very sensitive part of the vulva, and where a lot of individuals experience sexual pleasure. So the clitoris is a little mound of tissue that can be found where the two inner labia meet up. So this is the front of the body, and this is the butt. Okay, so then going backward toward the butt, there's a teeny tiny little hole, and if you take a mirror you can see this teeny tiny hole, but that's your pee hole. So it's your urethra. I'll label the clitoris too. Alright, so then a little bit further down from the urethra toward the butt again is the vaginal opening. And so there's going to be just a small little opening circle, but you might see some kind of floppy tissue around that opening. That's going to be the hymen. And this is the whole thing is going to be the vagina. Now, the hymen can look like a variety of things, and I've done a video on that previously, and I can talk about it in future videos, but that's essentially kind of the layout of the vulva. And again, you've got the clitoris toward the front, the urethra, the pee hole, the vagina, and then you'll see some floppy pink tissue in there surrounding the vagina, and that's going to be the hymen. So that's what the vagina looks like. All right. Last question. One side of my labia hangs lower than the other. Is this normal? Yes. Labia, again, the inner labia, so the inside. The outer ones are the labia majora, and they basically kind of keep things closed up. But the labia minora, again, are a little bit more floppy, loose tissue underneath those labia majora, and they can look like a variety of things. They can be very small and pink. They can be larger. They feel like a little extra tissue is there. It's going to be nice loose tissue. It can be different colors. It can be darker in color or lighter in color than your surrounding skin. And one can certainly be larger than the other. So however your labia look are absolutely normal. Some females are a little sensitive or a little self-conscious about the size of their labia. It is important to know that, again, labia come in all shapes and sizes, but ultimately, if the labia are a little too large and hanging so low that they get caught on your underwear or they rub on your clothing and you have skin issues, then you should talk to your doctor about that, and there are some things that can be done. But labia come in, again, a variety of forms, so love your labia however they are. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.